Now let's see the fractional flow reserve. Fractional flow reserve is going to be the ratio between the blood pressure distal to an atheromatous lesion divided by the blood pressure proximal to that atheromatous lesion. So here we have the heart. This is left atrium, left ventricle, right ventricle. This is the pulmonary artery. And this is the aorta. So we have the coronary arteries coming here. Let's say this is the coronary artery, left coronary artery. Here is the left coronary artery. And let's suppose we have an atheromatous plaque of this size. So flow is coming in this way. This is proximal. Flow is coming from proximal to distal. Flow is coming here, then passes through this narrower lumen and then continues here. So here we have less blood because here we have the atheromatous plaque that is occluding the lumen of the artery. So here we have more flow, we have more volume here. So we have a higher blood pressure than here. Here the blood is coming, but not all the blood that is coming here in the proximal segment can end up here in the distal segment because here is the narrower lumen. So of all the blood that is coming at this point, only few of that can come through the lumen at the site of the atheromatous plaque and then continue to the distal segment. So here we will have a lower blood pressure. So the blood pressure distal to the atheromatous plaque is less than the blood pressure proximal to the atheromatous plaque. So if this number is less than 75%, I mean less than 0.75, this means that we have a significant lesion. So blood pressure distal divided by blood pressure proximal to the atheromatous plaque is less than 0.75. This is a big atheromatous plaque that is impairing significantly the flow coming to the distal segment of the artery. Some studies suggest that if we have a higher fractional flow reserve, so higher blood pressure distal to atheromatous plaque divided by the blood pressure proximal to atheromatous plaque, then 0.75, I mean numbers greater than this, we can do conservative management, but less than 0.75 is a severe lesion, and so this ratio is the fractional flow reserve. Now this is measured with the flow being at maximum. This is we take some drugs, could be adenosine for example, that has a vasodilation effect, adenosine. So the coronary is going to be dilated. Instead of this size, it's going to be this size, but here is going to be the around the same size. So here we have the atheromatous plaque. So here, now that the patient is under the influence of adenosine, proximal to the lesion, the coronary artery is dilated. So we have more lumen here, so more blood, more flow comes here so we have more flow. This is like 4 to 5 times the normal flow we have at resting time. So here the patient is resting, we have a specific amount of blood and a specific flow coming here in the proximal segment. When we maximum dilate the artery, we have 4 to 5 times the normal resting flow, but here in the proximal segment. The distal segment also can be dilated, but at the site of the atheromatous plaque, here the vessel is rigid, so this part cannot dilate. So again, flow is coming this way. We have all this amount of flow coming, but at the site of the atheromatous plaque, not all the blood can pass through this point. So only this amount of blood, this amount of flow can pass. So again, here we have maximum dilated the coronary artery, where at the proximal segment we have more flow, so we have a higher blood pressure here than at resting, and here we will have also flow coming. We will have blood, but not the same as here because of this narrow point. So again, here we will have a decrease or a less blood pressure than here, and this ratio is going to be less than if we were measuring the ratio without adenosine, because here the same amount of flow is passing at the site of the atheromatous plaque, being without the adenosine effect as with adenosine effect, because this part cannot dilate. So the flow coming at the site of the atheromatous plaque is the same. So here we will have the same flow, the same blood pressure, but here, because the coronary artery is dilated under adenosine influence, we will have here higher blood pressure than here, and here we have the same pressure than here. So if these stay the same, but proximal blood pressure increases during adenosine, so this number as a whole decreases. So this is measuring the flow reserve, or the fractional flow reserve, because when here, when the artery is not dilated, we have flow coming, but when the artery is maximal dilated, we have only flow that can come is coming. So here we are using the flow reserve, here in the proximal segment and also in the distal segment, but here the distal segment is not dilating, or if it is dilating, is not causing any effect, because this point cannot be dilated because of this rigid plaque. So the fractional flow reserve is a measure of the blood pressure distal to the atheromatous plaque compared to the proximal segment of the coronary artery to the atheromatous plaque at the reserve status. So when coronaries are maximally dilated, if this during adenosine effect, I mean during the flow reserve status, is greater than 0.75, this is considered a severe lesion.